Hello, I'm James Wilson. I'm Professor of Philosophy here at UCL. I mostly work on public health ethics. I'm particularly interested in issues of justice and equity, which arise in thinking about the role of the state in protecting and promoting health. At the moment, I've been doing a lot of work on data ethics, particularly the use of NHS data to help control the coronavirus outbreak.
My name is Sonu Shamdasani. I'm a professor of the history of psychology and psychiatry, and I work on the history of psychological disciplines from basically the mid-19th to the mid-20th century. And my interest is studying how contemporary psychology and therapeutic practices took the form they did. So in a way, it's studying the histories of the present and to look at how history can help us make sense of what's going on today. And my interests are focused on a broad range of themes in terms of work on Freud, Jung, and history of psychotherapies. So both James and I are co-directors of the Health Humanities Centre here at UCL. What the centre does is it draws together figures working on issues to do with health and illness, both in the humanities and social sciences, and also figures in from biomedicine moving across to working on humanities aspects of their own work. And it starts with the issue that issues to do with health are too important to be left to the doctors, or don't only concern expertise within biomedicine, but reach out to all aspects of society, and hence require study from philosophers, anthropologists, historians, sociologists, and so forth. So it's both a research center, and it hosts these two courses: philosophy, politics, economics, and health humanities.
Yes, so I'm going to tell you a little bit about the MA Philosophy, Politics, and Economics of Health. So it has three core modules to it. I'll tell you a little bit about each of those. So first core module is called the Philosophy, Politics, and Economics of Health. This combines philosophy and health policy to really think about issues of equity and justice in the design of health systems. So we look at questions like the role of health inequalities, what role should be given to responsibility in healthcare, particular issues raised by communicable and non-communicable diseases. Second core module is health policy and reform. And this module allows you to look and to think about the design of health systems internationally and comparatively, so that you'll compare the way that the NHS works to a variety of other international systems, for example, those that rely on insurance, such as in the way that the US market does, or slightly different models in the European market. And the last core module is Key Principles of Health Economics. That provides you a solid grounding in thinking about health and economic modeling, how to interpret modeling, how to do a health economic analysis. And so between those three modules, they allow you to look at health policy from a variety of different perspectives, from the perspective of philosophy, health economics, and also from public policy. Every student gets the opportunity to do a dissertation as well. And the dissertation is very much led by you. You'll be able to dive deep into a particular topic in either sort of healthcare ethics or policy, or look more broadly about in aspects in the health humanities as well. And you'll also have access to a wide variety of options modules.
The Health Humanities Masters, which is run together with and alongside Philosophy, Politics, and Economics of Health Masters, is an interdisciplinary and multidisciplinary masters that looks at issues of health from the humanities perspective. And the two core modules are illness, taught by James, and madness, taught by myself. And the first question vis-a-vis madness is a sense of, like, in one way why we have two core courses, is to say, is madness illness? In a way, have you said everything you need to say about madness under the rubric of mental health, simply the mental form of illness? And the whole history of in Europe and the US of madness from the 18th century up to the present, and how that forms part and parcel of the making of modern sanity as defined differentially from madness, and alongside the history of the making of modern psychiatry and modern therapeutic practices. Alongside that, juxtapose that with readings from literature, which look at how individuals have both narrated their own experiences of states diagnosed as mad or described as mad, and also written critiques of psychiatric practices alongside that, and how, in a way, alongside the rise of modern institutional psychiatry and modern diagnostic categories, there is a counter-tradition which goes back to Plato of conceptions of a divine inspired madness, which is run right throughout Western culture and live with us today.
So I'll tell you a bit about the illness core module. But the heart of the illness core module is really the experience of being ill. We look at illness from the patient's perspective. And in doing so, we look partly at the sorts of narratives that patients themselves give us, either in sort of more literary writings or just in what they say when they're interviewed, in order to think about how being ill changes the experience of being human. And we're looking in quite some detail at different aspects of the experience of illness. For example, the idea of illness as a form of stigmatization, as a form of being set aside from ordinary people and perhaps thought of as inferior. We'll talk about the experience of chronic pain and also whether it is that we should fear death. And last, we think quite deeply about what it is to live well when you have an illness. So I hope that's given you an idea of the two courses, Health, Humanity and the Philosophy, Politics and Economics of Health. And we'll be very pleased to answer your questions shortly.
Yes, and just to add that both courses share a Health Humanities seminar where we invite colleagues from UCL and elsewhere to talk about their research work, and that's roughly fortnightly. And we run another series of workshops, seminars and conferences right throughout the year. With both masters, students can choose from a wide range of optional modules across UCL. We recommend a number that are suitable for both masters, but students can also choose beyond that, subject to availability and also their own interests. So in a way, you can tailor a very individual route depending on your own interests. So this term, we've currently been teaching online, given the current public health issue, and we hope to be able to see you in person in September, but if we're not able to teach in person, we will be teaching online, so the courses will both be running. Thanks.
Thank you.
And send us any questions you may have.